Imagine walking into a classroom, sitting next to someone who might be carrying a deadly disease that could easily be prevented. You might not know it, but the person next to you could be putting not just your health at risk, but the health of everyone around you. This is the reality we face when vaccinations aren't mandatory in our schools and our colleges. Vaccinations should be mandatory for all students enrolling in educational institutions to protect public health and ensure the safety of our communities. As college students, we're part of a close-knit environment, surrounded by hundreds, if not thousands, of people every single day. Our health does not just depend on individual decisions, but on collective responsibility. By making vaccinations mandatory, we are not only protecting ourselves, but also the people we care about, including those who cannot get vaccinated, like babies or the elderly. Today, I will discuss the science behind vaccinations, the public health risks of not vaccinating, and address some of the most common concerns and myths surrounding vaccines. How vaccines work and why they are effective. Vaccines work by training our immune system to recognize and fight harmful pathogens without causing us to actually suffer from the disease. They use small, inactivated pieces of the virus or bacteria so our body knows how to respond if exposed to it in the future. This process helps to build immunity without having to endure the illness itself. Another important concept to understand is herd immunity. When enough people are vaccinated, the spread of the disease slows down significantly, making it harder for diseases to affect those who are unvaccinated, like babies or people with compromised immune systems. Vaccines have already been proven to be effective in eliminating or significantly reducing deadly diseases. For example, diseases like polio and measles were once major public health threats that vaccines have helped nearly eradicate them. However, the risk of not vaccinating is very real. We've seen recent outbreaks of diseases like measles and mumps, which were once under control. These outbreaks have been traced back to unvaccinated populations, often fueled by misinformation or a lack of access to vaccines. Non-vaccinated individuals pose a serious risk to vulnerable groups, including infants who are too young to be vaccinated, the elderly, and those with a weakened immune system. For example, a measles outbreak can cause severe complications, even death, in young children or the elderly. And let's not forget about the economic impact. Preventable diseases result in hospitalizations and medical treatments, leading to billions of dollars spent annually, money that could be better used elsewhere. Despite the evidence supporting vaccines, there are still many myths and misconceptions. One of the most widely circulated myths is that vaccines can cause autism. This false claim was based on a study that has been discredited and retracted due to unethical practices. Another myth is that natural immunity is better than vaccine-acquired immunity. While it's true that the immune system is capable of responding to natural infection, it's important to remember that diseases like measles and polio can be fatal. Vaccines provide a safer way to build immunity without suffering the risks of the disease itself. Some people also argue that vaccines go against their personal or religious beliefs. However, in a society where public health is at stake, individual choices should not compromise the well-being of others, especially when it comes to highly contagious and deadly diseases. So, in conclusion, vaccines are not just a personal choice, they are a collective responsibility. Vaccines are safe, they work, and they protect against those who are most vulnerable. We've seen the consequences of neglecting vaccination, from preventable disease outbreaks to increased healthcare costs. It's time for us to make vaccinations mandatory for school and college enrollment to safeguard our public health. By making vaccinations a requirement for attending school or college, we ensure that our communities are safe and healthy. Vaccination isn't just about protecting ourselves. It's about protecting the people around us. It's a simple act that saves lives. Thank you.